Anatomy 32, Chapter 11, the Muscular System. Topics, muscles of speech, swallowing, and moving the head. So, mastication and speech. Mastication meaning, of course, chewing. So we have temporalis muscle. Temporalis muscle, a broad muscle that inserts into the mandible. Also, we have the masseter muscle, a smaller muscle on the lateral sides. That's origins in the mandible, or the insertion is in the mandible, and its origin is in the zygomatic bone. And then a very deep muscle, if you cut away the mandible to see it, is the medial pterygoid. The medial pterygoid going from the origin on the sphenoid bone to its insertion on the mandible. All three of these muscles do the same thing. They elevate the mandible. So temporalis, masseter, and medial pterygoid, all important for elevating the mandible for chewing, raising the jaw to chew or talk. Some additional movements they can engage in. Temporalis can elevate the mandible and retract the mandible, pull it back after it's jutted forward. Masseter can elevate the mandible and protract the mandible, so jut it out forward, jut it out anteriorly. And then the medial pterygoid can elevate and protract the mandible and also help move the mandible side to side, so laterally, kind of like how a cow would chew, I suppose. Then another deep muscle that is important is the lateral pterygoid. Again, its origin on the sphenoid bone. It inserts into the mandible. And this deep muscle does the opposite. It helps to control our lowering of the mandible. So it can do things like protract, stick out the mandible anteriorly, as well as depress the mandible, lower the mandible, and also produce that side-to-side motion. And this is a deep muscle. All right, then there's the muscles for deglutination, which means swallowing. We have a series of 3 muscles in the pharynx, in the throat, that are important for this process. The superior pharyngeal constrictor, the medial pharyngeal constrictor, and the inferior pharyngeal constrictor. And they act in a sequential manner to constrict and propel food to the esophagus. So from the mouth, you push the food back far enough, and then that triggers the swallowing reflex, and these muscles will again constrict in a sequential manner to push that food into the esophagus. Some additional small muscles that we have that are involved in speech include the styloglossus. The styloglossus muscle goes from the styloid process of the temporal bone to the tongue, glossus for tongue. We have the hyoid glossus muscle, hyoid glossus going from the hyoid bone to the tongue, and then the genioglossus muscle, genioglossus going from the inside of the mandible to the tongue. So again, glossus means tongue. So all of these insert into the tongue, so they move the tongue. Based on their location, you can get a good estimate for what they do. The genioglossus, being toward the front, helps to protract the tongue. So when it contracts, pulls the tongue anteriorly. The styloglossus muscle, being up and back, when it contracts, will help to retract the tongue, to pull the tongue posteriorly, and also pull it up to elevate the back of the tongue. And then the hyoglossus muscle, when it contracts, can help to depress the tongue as well as retract the tongue, pull it back posteriorly. And again, any of these muscles can be helpful in speech and deglutination. We need to be able to move the tongue for swallowing and for talking. Then there is the stylohyoid muscle. This goes from the styloid process of the temporal bone to the hyoid bone. And what this muscle does is it helps to elevate the hyoid bone, which means it is helping to elevate the larynx, and this can aid in both speech and in deglutination, in swallowing. We raise this portion of the larynx and trachea when we swallow. Then we have the sternohyoid muscle going from the sternum to the hyoid bone. And then we have the omohyoid muscle going from the scapular area up to the hyoid bone. So both of these are inserting into the hyoid bone, and they both act to depress the hyoid bone. So again, they are coming from underneath the hyoid bone, so they will depress the hyoid bone when they contract, important for speech and swallowing. Then we have the thyrohyoid muscle going from the thyroid cartilage to the hyoid bone, and the sternothyroid muscle going from the sternum to the thyroid cartilage. So when these muscles contract, the sternothyroid muscle going from the sternum to the thyroid cartilage helps to depress the thyroid cartilage of the larynx, which helps to help control in speech. And then the thyrohyoid muscle going from the thyroid cartilage to the hyoid bone can help to elevate the thyroid cartilage, important for speech. This muscle also has a reverse muscle action, so it can switch its origin and insertion, so it can also depress the hyoid bone. So it can elevate the thyroid cartilage or depress the hyoid bone. Then we have the digastric muscle. It's called digastric because it has two bellies, and in between them is, of course, a bit of connective tissue connecting the two bellies that actually goes through another loop that connects to the hyoid bone. So the digastric muscle, when it contracts, can help to elevate the hyoid bone. It also has a reverse muscle action, so it is possible for it to switch what its origin and insertion is, which would then allow it to depress the mandible. And then the mylohyoid muscle is this very thin sheet on the very bottom of the various layers of muscle for the oral cavity's floor. This most inferior muscle helps to elevate the hyoid bone when it contracts, and it also in the process can help to elevate the floor of the mouth. So again, this is the most inferior muscle of the floor of the oral cavity, and it is a thin sheet-like muscle. Again, these can aid in speech and swallowing. Moving the head. All right, here we have the sternocleidomastoid muscle. It is a broad strip of a muscle going from the sternum and clavicle bones and inserting into the mastoid process of the temporal bone. Very, very nice muscle. We have it on right and left sides of the neck. As such, when these both muscles contract together, they help to flex the cervical vertebrae and the head, aka helping us to look down or nod down. And if only one of these muscles contract, it helps to laterally rotate the head, basically in the opposite direction that it is located, or it can help to laterally flex the head, so rest the head on the shoulder, in that case on the same side that the muscle is. Flip to the posterior side of the neck, we have underneath the trapezius muscle, we have these two small muscles, semispinalis capitis and splenius capitis. So both of these are inserting into the skull, into the occipital bone or temporal bone. The semispinalis capitis muscle together helps to extend the head and neck, so pull the head posteriorly or back so you're looking up, or singly can help to laterally flex the head or neck, so lay the head on the shoulder on the same side of that the muscle is. Then the splenius capitis, which is more at an angle, together with both muscles contract can help to extend the head and neck. So again, help to extend, so pull the head up so you can look up. And singly, if only one of them contracts, can help to rotate the head in the same toward the same side that the muscle is located. So if it's contracted, it would pull the head toward the same direction that the muscle is located. And that is it for this part of chapter 11. Oops, preview.